guide us in making decisions for us, put elements of decision support, because you have hundreds and hundreds of patients on the corridors of various hospitals across the world. Could we look at elements of decision support to be layered on top of EHR that would guide us? And for some of you, the word EHR, when I say that, I take it for granted sometimes. It's basically, what I mean by that is electronic health record. The third piece, which is personal to me as well, because it's a social piece. And we had families and friends, and I've spoken to a lot of physicians and clinicians around the world. We had a lot of family members, and we had a lot of people saying that they want to see their loved ones who's in ICU or CCU. They want to see their loved ones. They want to see the oxygen saturation level. They want to speak to the pulmonologist. You can't just put me in the dark. You can't not say, come to the hospital. I need to see my loved one. I need to have a conversation. So that entire element, came into play and said, how can we do that digitally? So, for me, for us, these three elements stand out, and I'll kind of dive into it a little bit more. And coming back to my presentation title, Back to the Future, and just like the movie Back to the Future, it's important to kind of understand where the digital roadmap is heading from a healthcare perspective. And it's not 2, 3 or 4 years. You literally need to get yourself into Marty's car, kind of transpose yourself maybe 5, 7, 10 years, and then kind of see, are you ready for that change? Is the country, is the hospital, is the people ready for that change? So let's kind of jump into the car. Let's kind of transpose ourselves Let's transpose ourselves maybe 10 years and what the changing face of healthcare would be. Now, the top part, what you see on top is your electronic health records that's current. So the current digital environment and what they do. So yeah, I mean, from an interoperability perspective, the current electronic health records generally provide 25-30%. They really, some of them talk, some of them don't talk. Clinical decision support, yeah, 30-40%. Consumer engagement, are we people-centric? Do we put the patient first? 25-30%. So if you look at where we are right now, that's where we are. Now let's say we fast-track 10 years, and what is it that we see, and what are we hearing from the pundits? It all stems around three elements. It stems around AI, it stems around clinical decision support, whereby you can provide data in meaningful form to your physicians, clinicians, nurses, where they can make really informed decisions. It's centered around interoperability. You cannot have a patient going through a siloed environment. You want the data to flow with you. And most importantly, it's about consumer engagement, because the fact of the matter is the personality of you and I, that is the patient, has dramatically changed in the last 5 years. Now, if this is 10 years, we go into the same car that we transposed ourselves, and we push ourselves 25 years or 20 years. Now, where do we see ourselves? And there are a few Meditechs, and I'll touch on them briefly, and let's forget the left one. Let's just look at the one on the right. Designer babies, who would want that, right? Who would want designer babies? And it's a far-fetched idea, but hey, 15, 20 years, you never know. And that's the level of gene sequencing, we are doing right now, where we are taking the genotype, we're stretching it, and really looking at the chromosomal activity. The second one is nanotech, big impact there. The other one is brain-computer interfaces, 3D printed organs. All this is in that back to the future view of 10, 15 years. Now the question is, are we ready for that? And one of the big elements that's driving these meta tags is basically you and I. Because our personality has changed dramatically post-COVID. You can say pre-COVID you were less demanding, you were more giving, but the reality of the matter is you and I have dramatically changed. We have become engaged consumers. We really, really want to engage with the provider of services. You know, it doesn't, you know, we don't take facts for granted. We want to be empowered patients. You know, we want to partake in our own healthcare service. We want to be a part of EHR. And the last piece, wellness. It's, and I think COVID also has taught us that. You know, COVID has taught us a lot about staying healthy. So now how do you take segregated data sets and you bring them all together, and then how can you really promote your wellness? And I love this slide for two reasons. One, the bottom line is patients want care, right? Patients want care, but consumers want choice. And right now, we need to kind of merge the two together, because there isn't, the distance between the two is not very far-fetched. And the appetite for mobile apps, the appetite for virtual care, on-demand care, the appetite for self-service check-in. I mean, I was flying into Karachi, and one of the airlines actually said, meet person X, your metaverse cabin attendant. I mean, how cool is that? I mean, they have a metaverse cabin attendant. Could that not be a metaverse nurse in a far-fetched primary healthcare center that can, through AR, provide care to patients? I mean, those are the kind of elements we need to look at. And the last point, shared access. We cannot work in a disjointed data society. People are selfish, societies are selfish, organizations are selfish with sharing data. If we need to kind of achieve this kind of utopic view of where we want to be, interoperability is key, and sharing of data thereof. And you know, you and I, we really want to contribute to our own health. We want to kind of build our own wellness. I mean, through my Apple Watch, my life insurance tells me that I walk less steps and you won't get your 100 points. So if you do 10,000 steps, my life insurance gives me 200 points, times 5 in a week, I get 1,000 points. I can go to a smoothie shop, get a smoothie, or I can get discounts at various other places. Now that's incentivizing you, but that's incentivizing you to promote your wellness so that you can be healthy. So now I'm taking partaking in my own wellness. The second piece is we need to know the full patient story from cradle to the grave, and that's where integration becomes key. Having an electronic health record from start to finish, traversing the entire continuum, primary healthcare, secondary healthcare, tertiary healthcare, quaternary, is quite critical. You need to have integration, you need to have a robust database structure, but most importantly, you need to have that strong interoperability element. And then virtual care. I mean, this really was a byproduct of COVID. It was nascent, you know, it had various names. You can call it telehealth, in some markets they call it e-health. But virtual care really kind of propelled itself. I mean, you know, Zoom, WebEx, but from a healthcare perspective, because you couldn't see your doctor, the patient couldn't see your family members. You wanted on-demand care, and you know, you need to be cognizant about the pandemic we were in, and this is going to be even more and more. Our appetite as consumers is that I do not want to go to a physician and wait 15 or 20 minutes, irrespective of who he is. Your appetite is you want care right now, and that appetite is going to evolve over the next few years, as I said, from a consumer mindset perspective. I've talked about interoperability, I'm going to touch on that. Population health, this is quite important. Now when you start to aggregate the data of a country, be it various provinces in Pakistan or in any other country, and you start to look at a big data profile, and you start to do massive analytics on it, you start to delve into the realm of population health. And what you can achieve from that is absolutely amazing. We have seen that in many countries across the world, and it's important that we cross-analyze the data, because it could mean anything. It could mean whether I've taken less steps, and those steps mean that I've been slagging, I've been a slouch. So it gives a prompt to my doctor to say, hey, or my doctor or my care provider prompts me to say, get up, you've got to move. The second one, it could prompt me to say, my children are due for immunization. I need to take my kids through. Or it might just tell me my last, full blood count. The last time I went did a labs was 6 or 8 months. Maybe it's not a bad idea given the fact that you're 45 plus, you have high BP. Go and check your cholesterol, it might be good for you. Or the last piece, you're an absolute slouch, you haven't moved. I can see your Apple Watch is absolutely dead. You've got to change your lifestyle. Now all this data of a family goes into a registry. That registry starts to then proactively work through the population to say and improve the health of the population for the betterment at various levels, primary healthcare, secondary healthcare. It could be just a GP's clinic, but the clinician has the data to push or remind and proactively manage the health of the patient. At the end of the day, data beat banking, data beat manufacturing, data being healthcare. It's all about what we do with the data, and from a healthcare perspective, where is it needed most? At that juncture, when the doctor provides care to the patient, or provide nurse or anyone, if the relevant data sets is there, where the person can make an informed decision that can impact patient safety and patient outcome and improve health outcomes, then I think it's an absolute win. So we've been around for quite a few years, 53 years. I mean, a software vendor being around for 53 years is a long, long time. And in our typical implementation methodology, this is what we do. We implement an electronic health record system. It's a process, there's standard content. We kind of define predictable outcomes. We do data conversions, etc., etc. Now, in our experience, we have implemented the key pillars to that is people, process, technology, kind of bundled or held together by governance and active leadership, which is absolutely critical. But having implemented in low to middle income countries in Africa, Middle East, in South Asia, we have seen some commonalities, and this is where I'm coming from. So when I kind of showed you the path of 10, 15 years, there's still some challenges or hurdles that markets and LMIC environments face, which we should be cognizant about. And when we kind of work towards an implementation, we kind of ready ourselves for it. The first one, I'll just touch on it very quickly. The first one is people, right? There needs to be a strong executive leadership drive to manage and drive that implementation process. Training becomes a big issue. Staff attrition, staff erosion becomes a big issue. Staff development. People are a very important piece in the implementation of any software. Let's not underestimate that. And at the end of the day, it is the people that is using the software. The second one is process. So everyone wants a system. Hey, let's get a software system. Again, healthcare, banking, let's just get it. Let's automate from A to B. What are we trying to automate? What are we trying to do? What's the outcome for? What's the vision? And sometimes we have gone to customers, we've done implementations, but they lack the vision. They haven't been defined workflows of how are you going to register a patient? What is your best practice? How would you like to register? Or where do you think the process of registration will evolve in 3 to 4 years? What is those various elements? So process, having SOPs, clinical frameworks across the healthcare ecosystem is important, and defining that is also important. Technology. We have really implemented in tough markets. We have implemented a EHR on an oil rig off the shore of Lagos, Nigeria. The entire country of Botswana in southern Africa runs on our platform. That's 2.5–3 million people, 40 clinics. And there are some clinics in really desolate places, like the middle of the Kalahari Desert, where you have a Red Cross sign under a baobab tree, where you have a nurse popping out paracetamols to a patient. But the funny thing is, they are using a system. They're using an integrated system. It's rudimentary, but they're using it. But that data gets pushed, appended to the central database. So at any moment of time, when the Ministry of Health wants to pull a report on the utilization rates or census reports for primary healthcare, they can do that. So, you know, technology is a big component, and we have learned one needs to adapt and evolve to that. You know, latency, internet connectivity, infrastructure, cloud readiness, etc. Governance, this is critical. You know, we get the software vendor, we pay the software vendor, we get the people, we hire the people. But if proper governance pillars is not there, when you're embarking a digital strategy, everything crumbles. Starting from executive oversight, looking at professional committees across the hospital, across the clinic, looking at stewardship, antimicrobial, and then more than anything, support from the EHR vendor, because there's a misconception that software vendors should come, implement the system, say cheers, and start charging support fees. No, it doesn't work that way, because software grows, software evolves, and the software vendor or partner needs to provide that required support, irrespective whether it's on-site or remote, as much as possible. Guys, that's the end of my story. I don't want to take too much of your time. Madam NC, thank you for your time, and thank you for the great work you're doing.